And health care is expected to be a hot topic at next week's Democratic debate. So who is pitching what? Healthcare expert Seth Denson is here to break it all down for us. Good morning. Back to the campaign trail, 10 candidates, one stage, the third Democratic debate in less than 1 week. And with health care becoming one of the top issues of the 2020 election, we're taking a closer look at the Democrats' plans. Author of The Cure and healthcare expert Seth Denson joins me now with a closer look. Thank you very much for joining us. We appreciate it.
Good to be with you this morning.
So we're talking about that debate coming up. Let's take a look at who is going to be participating in that. We have 10 candidates now that were able to meet the qualifications for it. And of course, as we said, one of the big issues will be health care.
That's right.
And we can see from this poll that 36% of people think that that is the top issue facing America today. You know, economy coming in second there, 10% less, but health care, big issue for them. So when we take all of the candidates, of course, everyone talking about Medicare for all.
Right.
And everyone at home, you can see over here, we have the candidates that support some version. These do not support it.
That's exactly right. Listen, let's be real, though. When you start talking about Medicare for all, it's not Medicare at all. And so when you start to break down the policy, it really is more of a politics scenario. And so the challenge you have with everybody that's talked about Medicare for all or single payer is they quite frankly haven't shown how they would pay for it. $3.4 trillion is what most of the plans that have been proposed would cost. That's roughly double the current, or that's the current tax rate. So we would have to double the current tax rate just to pay for it.
Yeah, I think Bernie Sanders has been the only one that has at least been honest about raising taxes to cover it. Their stance on private insurance, you can see the candidates that say they want to get rid of it. It can stay for now and then don't need to end it.
Yeah, this is an important thing to look at because you got to understand, if you are talking about Medicare and Medicare for all, the current Medicare system utilizes the private pay system. So you would have to completely dismantle the current private pay system to implement what is Medicare for all. The other thing to consider here that hasn't been talked about a lot, you've got 3 million jobs currently tied in to the private pay system. If you eliminate it, you eliminate 3 million jobs overnight.
And people need to be aware of that. So the next one is the candidates who support creating a public option, and you can see all of the Democratic candidates on board for this.
That's right. So interestingly enough, everybody's saying that the government needs to get into the business of running health care. Well, the government hasn't done a great job with the VA lately, so likely nobody wants to go stand in line at the post office for their health care these days. And so the challenge you have, though, the only candidate that's come out with any type of financial modeling is Joe Biden, which actually is still $500 billion short of what the public option would actually cost.
Oh, wow. So no doubt he'll be talking about that in the debate coming up.
That's exactly right.
Covering illegal immigrants. Illegal immigrants should be covered under the health care plan. These candidates say yes. These candidates say no. These candidates kind of unclear. They haven't said one way or the other. And then yes, but with a caveat is Yang, who says that they have to be on a pathway to citizenship in order to be covered by the health care plan.
That's right. So, you know, herein lies a big debate in the United States. Americans have good hearts. We want people to be taken care of. But we also have a lot of citizens right now that don't have health care. So the concern should be about our citizens first, and then let's start talking about how we reach out our hands to others.
Yeah, speaking of reaching out, importing drugs from Canada. So this is another topic that's come up recently. These candidates say yes, these candidates say no.
Yeah, so right now in the current healthcare system, there's a lot of protectionism for pharmaceutical companies in the United States. This is actually something that most Americans should get on board with. We should be in favor of some free market. Now, what does that look like? There needs to be a lot of conversation about that, but we need to talk about the idea of bringing in drugs from other countries.
Meaning that could lower drug prices for people?
That's the hope, right? In a free market system, competition does help drive down costs.
Yes, which is the idea that lies behind healthcare in general.
That's
All right, thank you so much for joining us.
Thanks
that was great. Got through a lot there.